why knee pains occurs in old age people? Obviously, it is because of the quality of the bone and then the degenerative changes of the bone. The commonest problem in the old age is there will be degenerative changes in the joints. The degenerative changes in the joints obviously causes there will be erosion of the soft tissue. Now, when you see this, you can see in the joint there are two muscles, two caps. These are the soft tissue. These are the soft tissues where because of the wear and tear, the necrosis of the soft tissue, absorption of the soft tissue leads to the wear and tear between the hard bones of the knee. So this is the way in almost all the joint, but in the knee and hip, the commonest cause for the pain in old age is the degeneration of the soft tissue leads to rubbing over or friction between the two hard bones leads to pain, swelling, deformity, tenderness. So these are the four characters you see it in the old age problems. So this is the main factor we must know. And then obviously when the old age people suffer pain, swelling, deformity and friction, then that means you must have you should have that the deformity should be corrected and the pain should be relieved. So in that point of view, there are stage 1, 2, 3, 4. The stage 1, the early age, between the 40 to 50 age, there will be stage 1 deformity or arthritis, where the joint initially swelling will be there. There is a little pain in the tenderness in the joint. That immediately we can dealt with in a proper physiotherapy exercises, and then certain applicants, ointment applicants, liniments or ointments, and then you can give a brace to support it and make them walk. If there is a cause you should know, then you can treat, whether it's an immunological arthritis or any other disease should be treated. Then if there is a old age bony pains are because of the osteoporosis, where this bone mineral will be reduced. In that bone mineral, when it is reduced, then obviously there will be possibility of fracture in the bone. Fracture in the bone also leads to a pathological fracture. And then when there is a bone density is weak, that means the bone quality should be maintained, whether certain because of the vitamin D deficiency, and certain cases calcium deficiency, and certain cases you see mineral deficiency. These all causes like rickettsia or other osteomalacia, chondromalacia. These are such factors where you see certain deficiencies, the older age people will develop certain problems. So these problems should be dealt, otherwise the patient will develop lot of pains, lot of deformities, lot of arthritis, lot of osteitis problems that could be dealt and treated properly. So in old age, you know that the muscles tendons are very weak, and that age group when the muscles tendons are weak, there is a possibility of tear in the tendons or the muscles because of the weak of the muscles. So obviously there is a laxity of the muscles because of the old age problem. There will be chances of tumors in the bones that either it could be a non-cancerous or cancerous bone tumors. There will be a lot of spondylosis problems, spondylitis problem, and spondylolisthesis problem in the old age problems. So these are the spine problems or back pain problems we must dealt. So it could be neck problem, it could be back over the problem, or it could be because of the osteoporosis of the spine. There will be simple trivial injury also causes wedge fracture of the vertebra, and that should be dealt properly. And apart from this, there is the old age problems like arthritis. In that arthritis, you can see there is a possibility of rheumatoid arthritis, gouty arthritis, or seronegative arthritis, and then degenerative arthritis. So you must know all these things in the old age people whom get these commonest problems.